This video is about OET writing for podiatry and dentistry. Imagine a surgical list drawn up with missing details. For example, a podiatrist, unclear referral causes a delay that complicates a diabetic patient's recovery. Or you can think of a dental referral lacking urgency, leaving an oral surgeon short of crucial information. In clinical letters, we don't just inform, we protect patients, speed care, and reduce the risk. So today you will get new examples for podiatry and dentistry and an exact breakdown of why these letters earn top marks. Okay, the first one is OET letters or clinical tools that you need to understand: purpose driven, clinical, concise, and reader focused. Typical recipients, yes, specialists, multidisciplinary teams, community services, GPs, or allied health professionals. And some of the essentials that you need to follow while writing the letter. For example, you have to state the purpose immediately and include only relevant treatment findings or any risk. And you have to recommend a clear action for that. For this one, you have to use a formal, direct clinical language, no contractions. Remember that. And if you go for examiner priorities, like in what way they prioritize, first they'll see for the task fulfillment, whether the purpose is achieved or not. Then they go for the clinical relevance and accuracy. Then comes organization and clarity. And finally, your language accuracy and range. So remember to keep all the elements covered in your writing. Okay, so let me tell you a step by step approach. The first one is you have to read the task. First, you need to read it, identify the recipient and the purpose in about 10 to 15 seconds. Then, triage the notes, which means you have to select the facts that impact the decision making, like history, current signs, medications, allergies, or investigations. Then you need to do the plan, like four short paragraphs mapped to reader needs. Remember that. And write. Keep sentences short, use headings sparingly, only if allowed, and use active voice when possible. And try to close with an explicit request or recommendation and try to offer to supply further information. What information is required, that information you should be able to provide. And you have to check quickly whether you have addressed all the bullet points and is there any ambiguous abbreviations that you have mentioned, and spelling of the medicines, dates, dosages, all these things. Okay, now let's move on to an example here. So this is the case notes for podiatry. Patient name Mr. Samuel Green, 72 years, long-standing type 2 diabetes, peripheral neuropathy. And the presentation is deep plantar ulcer beneath first metatarsal head, 4 centimeter into 2.5 centimeter, purulent exudate, malodor, surrounding erythema extending 2 centimeter, temperature elevated locally, vitals and labs afebrile, recent HbA1c 9.1 percentage, 2 months, and WBC mildly raised. And the past things are peripheral vascular disease diagnosed 1 year ago, ABI last year 0.8 point 0.8, and the treatment so far is given here: daily hydrogel dressings, oral doxycycline started 5 days ago, patient advised offloading but limited adherence, and the purpose given here is urgent referral for vascular assessment and possible admission for IV antibiotics and surgical review. Okay, so these are the case notes. Now you need to write a letter. Let's see. So first mention the date and the recipient. We'll keep it as Miss Kathleen, vascular specialist. What coordinator? Regarding Mr. Samuel Green, date of birth 10th March 1953. If you want, you can just pause the video, go through this, and try to find out how we have covered the elements for this writing, the strategies that we followed. Okay. Dear Miss Kathleen, I'm referring Mr. Samuel Green, a 72-year-old man with long-standing type 2 diabetes and neuropathy, for urgent vascular assessment and specialist wound management due to a deep plantar ulcer beneath the first metatarsal head of their right foot. Clinical summary: the ulcer measures approximately 4.0 into 2.5 centimeter with purulent exudate and malodor. Surrounding erythema extends 2 centimeter with localized warmth. He is afebrile, but laboratory tests show a mildly elevated white cell count. Most recent HbA1c is 9.1. Mr. Green has known peripheral vascular disease, ABI 0.8, recorded 12 months prior. Current management is daily hydrogel dressings have been performed at our clinic. Oral doxycycline 100 mg commenced 5 days ago. Offloading has been advised, but the patient reports difficulty using the recommended device and partial adherence. There is concern for progressing infection and impaired perfusion, contributing to poor healing. And the request is given the ulcer depth, risk factors, that is poor glycemic control, probable ischemia, partial non-adherence to offloading. I request urgent vascular review to assess limb perfusion and consideration for admission for IV antibiotics and potential surgical debridement or revascularization if indicated. Early multidisciplinary management would likely reduce the risk of limb loss. Please contact me if you require radiographs or wound photographs. I can forward current images and dressing notes. Now, let me break this down now. The first one is the purpose and the reader focus. We say it as a task fulfillment, right? If you see here, the purpose appears in the opening line itself. Like, I'm referring Mr. Samuel Green, 72-year-old man with long-standing type 2 diabetes and neuropathy for urgent vascular assessment. Okay. So the examiner sees immediately that the referral fulfills the task. Okay. And the request section explicitly states the action required, like vascular review to assess limb perfusion, and then consideration for admission for IV antibiotics and potential surgical debridement or revascularization. So, examiners look for a clear ask. This letter provides it. Okay. The next one is clinical relevance and selection of detail, that is also majorly included here. Only information that affects management is included. If you see here, ulcer size, okay, ulcer size, depth, exudate, ABI, current treatment, all these have been given, but not irrelevant details. Nothing like social chit chat, okay? Of course, language and tone, it's a formal clinical tone. We have not used any contradictions, and we have used active voice, right? Which improves the clarity and professionalism, and use of precise clinical phrases also there. The risk and urgency also we have mentioned. This letter balances urgency with justification, like what is the concern for progressing infection and impaired perfusion. So that one justifies prioritization. Now let's move on to the dentistry case notes. Here are the case notes. If you want, you can just pause the video and go through it so that I can give you the response, the model response from my end. Now, let me move on to the response here. So here is the response. Date I have given, recipient's name, and then regarding Miss Purley, date of birth 4 May 1996. Dear Dr. Lim, I'm referring Miss Purley for urgent assessment and likely extraction of tooth number 46 under general anesthesia due to an acute odontogenic infection with evidence of spreading soft tissue involvement. Clinical summary: Ms. Purley presented with severe right mandibular pain, intraoral fluctuance buccal to number 46 trismus, and systemic temperature of 38.1 degrees Celsius. Periapical radiographs shows a large periapical radiolucency at 46 consistent with abscess. Immediate incision and drainage was performed yesterday with local anesthesia. She has been started on metronidazole 400 mg TDS. She has documented allergy to penicillin Analgesia, paracetamol 1 gram as required and ibuprofen 400 mg TDS unless contraindicated. And the request here is given the extent of swelling, systemic signs, and limited mouth opening. I request urgent OMFS assessment for extraction under GA and evaluation for hospital admission if the infection is not contained. Please note her penicillin allergy and current antibiotic choice. Radiographs and the operative notes from yesterday are attached. If you require further information or intraoral images, I can forward them immediately. So this is the response. Now, if you see this response, it served the purpose and the clinical priority, right? So the opening sentence, it makes the purpose explicit and it frames urgency, like urgent assessment and likely extraction, isn't it? Due to so and so, with the evidence of spreading soft tissue involvement. So this clearly states the purpose and the clinical priority. And the next one is clinical facts and safety information. Yes, we have mentioned the red flags such as trismus, systemic temperature, and then fluctuance, all these things. Also, allergy for penicillin has been documented, which is very critical for safe prescribing and a high value detail that examiners respect in dental OET letters. And the treatment already given and the current medications also mentioned with the name, dosage, frequency. So this avoids duplication and helps the surgeon plan perioperative care. Okay. If you see the request, that is very much precise and actionable. So ask for OMFS assessment and extraction under GA and for admission if indicated. So examiners look for a clear, reasonable recommendation. This is it. Okay. And finally, which we have stated about the radiographs or notes attached, which is a very practical and it shows good clinical communication practice. Okay. So concise sentences with clinical nouns and verbs, it mirror the genre expected by OET. No weak hedging. Okay. So this letter demonstrates task fulfillment, safe clinical practice, clarity of urgency, and professional tone. All features that align with OET band descriptors. That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.